Hey, welcome back to the CPRS introduction videos. I wanted to next go over the labs, how to best look at labs here. So I'll show you a few different ways. So my preferred way is to use worksheets. So if I wanted to look at what the trend of sodiums or creatinines has been, I'll go to a test group that I created. If you need to know how to create test groups, go back to that CPRS initial setup video. And I'll click this and I'll click OK. And then your date range is usually something like the last 7 days, and that's usually pretty fine. Just as I'm using a test patient, ZZ Test Debbie, she doesn't have any information from the last 7 days. So I'm going to go to all results here, and you can see a nice graphic trend of her sodiums and her BMP. She obviously was very hyponatremic. You don't know this about Debbie, but she's a big drinker who doesn't keep up with her PO intake at all. But you wouldn't realize that with her creatinine. It's kind of an anomaly in that respect. But her urine sodium's all over the place too. So anyways, and she has a lung cancer, FYI. So what you can do is you can see a nice graphic trend here of all the BMP in the last 7 days. If you technically want a graph, the best way to do that is to go here, remove all, and just put one item in here. So let's do sodium graph to see what her sodium chart has looked like. And this is the same thing that Epic does. And you can go to here, click graph, and then you just want to make sure that you've got the right sodium here. So this is a serum sodium and a plasma sodium here. So this serum sodium, and you can see lower limits of normal, upper limits of normal, and where she's kind of trended. And then this is the date range that's specified up here. So that's one way to look at graphs. The other way that some people like is this cumulative lab review. Now, I don't like this specifically, but other people do, so I'm going to show it to you. This is every lab that's ever been ordered within this time frame. So don't take that to the bank because I don't use it very often, but I'm pretty sure that's what this is. And so what it is, it groups the CBCs, and if you scroll down, it groups the BMPs together, and it groups all the labs together based on kind of their generic body system is the easiest way to put it. So I don't like this, but feel free to play around with it. Maybe you'll like it. Obviously, the most recent is a very useful one to look at in the morning, and what I'll always look at is I'll look to see which labs came in the most recently. So her last lab was July 29th, and I'll click back from the day's labs just to kind of get a feel for what's going on. Importantly, remember that your micro is separate from your labs. So your micro is found here, and then it's based on collection date, and so it starts with the newest to the oldest, and then this is the actual source that it was from. So collection sample there. And then you have to actually physically click on them, and it'll show you what it grew, or she has H-flu here, probably because she has an obstructive pneumonia that we talked about from her lung cancer, given that sodium that she had before. If you're looking for path, that's here, path reports. And then the very last thing to kind of look at is, once again, under this lab tab, worksheets, and then you can search for any lab if it's something that you don't order very often, like an ANA panel. And you'll hit OK there, add it, and then pull it up, and then all results. So it doesn't look like she has lupus, which is good for her. So that's it for the lab worksheet. I hope that you've enjoyed this particular video. I hope that it makes your life a little bit easier and demystifies CPRS just a little bit. Thank you.